Hi, my name's Sirsha, and today I will be talking to you about cerebral palsy. So, what exactly is cerebral palsy? According to the Center for Disease Control, the official definition of cerebral palsy, commonly referred to as CP, is a group of disorders that affect a person's ability to move and maintain balance and posture. Cerebral means having to do with the brain, and palsy means weakness or problems with using the muscles. The CDC states that CP is the most common motor disability in childhood. So, what causes cerebral palsy? CP is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Unfortunately, the cause isn't often known. However, there are many different risk factors that can lead to changes in brain development. These include gene changes that result in genetic conditions or differences in brain development, maternal infections that affect an unborn baby, stroke, which interrupts blood supply to the developing brain, bleeding into the brain in the womb or as a newborn, infant infections that cause swelling in or around the brain, TBIs, traumatic head injuries to an infant, such as from a motor vehicle accident, a fall, or other physical trauma. And finally, lack of oxygen to the brain related to a hard labor or delivery. Although I want to point out that this cause is less common than was previously thought. The National Health Institute of Neurological Disorders and Stroke states that doctors classify cerebral palsy according to the type of movement disorder involved. There are four main types of CP: spastic cerebral palsy, dyskinetic cerebral palsy, ataxic cerebral palsy, and mixed types. Spastic is the most common form of cerebral palsy. Those with this type have stiff muscles and awkward movements. Dyskinetic is characterized by slow and uncontrollable writhing or jerking movements of the hands, feet, or arms, or their legs. Ataxic affects balance and depth perception, and mixed types of cerebral palsy refer to symptoms that don't correspond to any single type of CP but are a mix of multiple types. In the next few slides, I'm going to describe each of these types in a little bit more detail and talk about the characteristics or the behaviors you would expect to see. So, with spastic CP, as I said, it is the most common type of CP. As of 2019, Johns Hopkins found that approximately 80% of people with cerebral palsy have spastic CP. People with spastic CP have increased muscle tone. This means their muscles are stiff, and as a result, their movements can be awkward. Spastic CP usually is categorized by what part of the body are affected. First, there's spastic hemiplegia. It typically affects the arm and hand on one side of the body, but it can also include the leg. Children with spastic hemiplegia generally walk later and they walk on tiptoe because of the tight tendons in their heel. The arm and leg of the affected side are frequently shorter and thinner. Some children will develop scoliosis, an abnormal curvature of the spine. Speech is delayed and, at best, may be competent, but intelligence is usually average. Next, there's spastic diplegia. In this type of CP, muscle stiffness is mainly in the legs, with the arms less affected or not affected at all. Some characteristics that people with spastic diplegia might have include difficulty walking because tight hip and leg muscles cause their legs to pull together, turn inward, and cross at the knees. Then there's spastic quadriplegia. This is the most severe form of cerebral palsy, and it's often associated with moderate to severe intellectual disability. It is caused by widespread damage to the brain or significant brain malformations. Children will often have severe stiffness in their limbs and face, but also a floppy neck. They aren't usually able to walk. They also often have other developmental disabilities, such as intellectual disability, seizures, or problems with vision, hearing, or speech. Dyskinetic CP, also referred to as a thetoid CP, is the second most common type of cerebral palsy. It's characterized by slow and uncontrollable writhing or rapid and jerky movements of the arms, feet, hands, or legs. Hyperactivity in the muscles of the face and tongue makes some children grimace or drool. They also may have a hard time swallowing, sucking, and talking. Those with this type of CP find it difficult to sit up straight or walk. Some children have problems hearing, controlling their breathing, but however, their intelligence is rarely affected. Children with ataxic CP will often have poor coordination and walk unsteadily with a wide-based gait. They have difficulty with quick or precise movements. This could be something like writing or buttoning a shirt. They also have a hard time controlling voluntary movement, such as reaching for a book. Mixed types of cerebral palsy refer to symptoms that don't correspond to any singular type of CP, but are instead a mix of types. For example, a child with mixed CP may have some muscles that are too tight and others that are too relaxed, creating a mix of stiffness and floppiness. There is no cure for cerebral palsy, but supportive treatments, medications, and surgery can help many individuals improve their motor skills and ability to communicate with the world. Cerebral palsy is the most common motor disability of childhood. About 1 in every 345 children has been identified with cerebral palsy, according to estimates from the CDC's Autism and Developmental Disabilities Monitoring Network. It has been shown that children born with a body weight below 1,500 grams are 70 times more likely to have cerebral palsy when compared with a group of children with a body weight over 2,500 grams at birth. 85 to 95% of cerebral palsy is congenital, which means that it has happened before or during birth. Between 50 and 60% of children with cerebral palsy can walk independently. I want to pause for a moment and talk about related and co occurring conditions. Many children with cerebral palsy have one or more additional conditions or diseases along with their CP. These are known as co occurring conditions. Intellectual disability. Approximately 30 to 50% of individuals with CP have an intellectual disability. About 4 in every 10 children with CP also have epilepsy, seizure disorder. As many as half of all children with CP have one or more seizures. Children with both cerebral palsy and epilepsy are more likely to have intellectual disabilities. About 1 in every 10 children have with CP also have autism spectrum disorder. Speech and language disorders, such as difficulty forming words and speaking clearly, are present in more than 75% of people with cerebral palsy. Many children with cerebral palsy have strabismus, commonly called cross eyes, which, when left untreated, can lead to poor vision and can interfere with the ability to judge distance. Some children with CP have difficulty understanding and organizing visual information. Other children may have poor vision or blindness in one or both eyes. Impaired hearing is more frequent among those with CP than in the general population. Some children have partial or complete hearing loss, particularly as the result of jaundice or lack of oxygen to the developing brain. Some individuals with CP experience pain or have difficulty feeling simple sensations such as touch. Children with cerebral palsy may have difficulty processing particular types of spatial and auditory information. People with CP are at a greater risk of developing anxiety, depression, and social and emotional issues. Children with CP may have difficulty processing particular types. Oops, sorry, looking at the wrong note here. IDEA. Students with cerebral palsy could be served under two different IDEA categories: orthopedic impairment or multiple disabilities. Students served under the orthopedic impairment category have a severe orthopedic impairment that adversely affects their educational performance. The term includes impairments caused by a congenital anomaly, impairments caused by disease, and impairments from other causes too. As I mentioned earlier, a lot of students with cerebral palsy also have other co-occurring conditions. So, there will be some students with CP that are served under multiple disabilities category instead. To be served under this category, students must have concomitant impairments. So, this would be the student would have intellectual disabilities and blindness, or they'd have an intellectual disability and an orthopedic impairment. The combination of their impairments causes such severe educational needs that they cannot be accommodated in a special education program solely for one of the impairments. This is a table from the National Center for Education Statistics. It shows that children aged 3 to 21 years old who were served under the Individuals with Disabilities Act for the 2021 and 2022 school year. The figure shows that there were 32,969 students with orthopedic impairments in the United States for the 2021-2022 school year. 125,167 students with multiple disabilities in the U.S. for the 2021-2022 school year. It also shows that 1 in every 200 students have an orthopedic impairment, and almost 2 out of every 100 students have multiple disabilities. There is no single right, least restrictive learning environment for all CP students. Because the disorder has such a wide range from pretty mild to extremely severe, some students may not need any assistance or may have slight problems such as difficulty walking and require minimal assistance. Others, however, may have intellectual disabilities, speech and language disorders, learning disabilities, etc., and they would be in need of a more restrictive learning environment. They could require special equipment, additional assistance individually in the gen ed classroom, or placed in classes with students that have similar needs as they do. And some students may need programs that are provided outside of the traditional school setting, including at the student's home or even in a residential facility. So, the decisions of the LRE placement must be made by the student's team based on their unique needs. But who is on the team for a student with CP? Well, each student with CP will have a team of individuals play a role in planning the student's education and educational needs. The more familiar a member is with a child's condition, the better they will be able to enhance their potential for learning. Some members may only be needed for short periods of time in a child's life, while other members may assist the child for several years. The various team members will use their specific backgrounds to assist the student or provide guidance. Some of the individuals that may play a role in a child's education planning team include, but are not limited to, parents, assistive technology specialists, counselors, general education teachers, hearing specialists, occupational therapists, paraprofessionals, physical therapists, physical education instructors, psychologists or social workers, school administrators, school nurses, special consultants, special education teachers, speech and language pathologists, transportation specialists, and vision specialists. Education and cerebral palsy students. There's a few things that teachers can do to help students with cerebral palsy. Of course, it will depend on the individual themselves. As mentioned earlier, the disorder has such a wide variety of intensity, so some of these may work very well and some of these may not. It all depends on the student that you are working with at the time. But the main ones that are proven to help are changing up instructional methods. Now, this is a great strategy to help all children, but especially those with CP. Teachers know that everyone learns differently, so changing the delivery of content and instruction ensures that each child is included. Variety is especially important for a child with cerebral palsy who may struggle in ways other neurotypical and able bodied children do not. Try to use direct instruction, small group discussions, hands on experimentation or up close experimentation, quiet reading, videos, and computer learning, and all types of strategies to reach each child. Another thing that teachers can do is provide choice. Um, Along with the idea of varying instruction, students, providing students with choices when possible can help promote more involvement and reaching those with different learning styles. Providing more choices, such as what book to read, doing safe internet research, or listening to a podcast or watching a video to gather information, helps students get more engaged in their own learning. A major thing for teachers to do for their students with cerebral palsy is record lessons. There's a pretty good chance that students with cerebral palsy in elementary school will be missing class from time to time. They will have doctor's appointments, physical therapy appointments, speech and language appointments, and so on. By recording your class, it will allow them to watch the content and not fall behind when they have to miss school. Students with cerebral palsy may also experience chronic and reoccurring pain, um, because this can come at any time, anywhere. There's a chance it'll affect their behavior if it happens during class. They may become less motivated to join in or interact with others, or they could become distracted and miss out on the lesson. But by having a recorded version, they can again go back and watch it later when they're ready, and again they will not fall behind. An added benefit with this is that they can also rewatch it if they're not understanding something that they're learning in class. And they can then discuss with you what they're having difficulties with. And you can sit down with them for an individualized instruction session and really help them to understand that particular part that they're having some trouble with. Active participation and inclusion. Children with cerebral palsy need to be actively included. Students with CP are really at risk for exclusion, so taking steps to make sure they are being included needs to become an active part of the day. Once teachers are aware of this, there are some steps they can take to help include those who are less likely to be excluded. They can try calling on a child during discussion, assigning a child a leadership position, starting small and structured group activities, and requiring all to participate in some way. And another really great way is class wide peer tutoring. Accommodations and modifications. The physical environment. Most children with cerebral palsy have some degree of physical disability. This could range from a minor foot drop to needing a motorized wheelchair to be mobile. Even for the more minor disabilities, moving around can be very difficult and it'll take them more time than other children. But we can provide adequate space between desks, chairs, and other objects in the room. And it's just a simple modification that teachers can make to ensure that no corner and no space of the room is off limits to them. And it's something that will definitely make them feel more included and more welcome in the class if they're able to easily get around it and feel like they have a place there. Social interactions. Um, it's important to encourage the adults and support staff to give children space to explore and participate independently. This will help a child feel a sense of belonging and allow them to make friends with other children. Um, you can encourage the student to use their preferred method of communication and even consider teaching them and the class some gestures they can use to alert others of their needs. Academic. Some children with cerebral palsy may find completing homework tasks without support challenging. It may be helpful to work with students' parents to develop an effective and consistent homework routine at home. Consider discussing or demonstrating teaching strategies and reward systems used in the classroom. Students may also need accommodations to the material, um, such as more time for completing their tests or activities, or modifying the materials so they can use their assistive devices instead of pencil and paper. Assistive technology and adaptive equipment for children with cerebral palsy. It's very, very important. Um, so these types of equipment includes any device or piece of equipment to help perform an activity or improve the ability to function. Assistive technology and adaptive technology um, for children with cerebral palsy can provide countless benefits um, that are including but not limited to better academic performance, more inclusion in activities and recreation, a more engaged social life, improved communication with others, and a better response to a child's need. As a result, it can also increase their ability to express emotions and express their thoughts. Uh, it can enhance their self confidence and give them greater independence and self sufficiency and provide them with more opportunities overall. There are 5 different types of assistive technology for CP students. There is technology for mobility, technology for communication, typing and writing devices, hearing aids, equipment to help with daily activities. Technology for mobility. While the symptoms and complications of cerebral palsy can vary widely from one individual to the next, most children with this condition have some degree of limited mobility. Many children are unable to walk, while others can walk with assistance and some without any support at all. Aids used to enhance mobility can be low tech, so this includes the use of walkers and non electric wheelchairs, um, braces, crutches, gait trainers. Gait trainers will help children with cerebral palsy develop their walking skills. There are also aids that use more high tech technology, such as electric wheelchairs. Um, these help children who struggle to use their arms and hands. It lets them get around with just the touch of a button or a joystick. Lifts can be used to help a child move between floors in the home, into and out of vehicles, and from sitting to standing position. A power scooter is another option for mobility. Technology for communication. For many children with cerebral palsy, communication is an issue. A child may have muscles in the throat and mouth that are affected by the condition, creating difficulty forming words. This makes it challenging to express emotions and needs, to learn in school, and to be social with others. Children can work with speech and language therapists to improve communication skills, and these professionals often use assistive technology, such as electronic communication boards. These devices are like a tablet, or may even be a tablet, using a special app or program. A communication board presents the child with a choice of letters, words, numbers, and pictures. The child can then select them to communicate with others. Depending on a child's ability, they may need instruction from a speech or language therapist to use a communication board successfully. Low tech communication boards. The low technology version of this is using a pencil and paper to express oneself. This is only useful, though, for a child who can grip a writing implement and use it to clearly write words or draw pictures. Um, the more accessible and easier to use version of this would be boards containing photographs or objects that a student can point to, such as a glass of water or the bathroom, a picture of a toilet or a pencil. Um, this way, a child who is too young or is unable to deal with the complexity of a tablet may indicate their needs. Speech generating devices. They're a more advanced version of an electronic communication board, and they actually function to generate speech. The child types or taps words and sentences, and the device formulates it into speech that others can understand clearly. Eye tracking devices. They're a type of device that's best used with children who are unable to use their arms or hands or their fingers to tap at images on a communication board. These individuals can benefit from an eye tracking device which follows where their eyes are moving and looking. When the child looks at a specific word or a specific image on the communication board, it is selected without the need to actively tap on the surface. Typing and writing devices. Many children with cerebral palsy struggle with the fine motor skills needed to hold a pen or pencil and to hit individual keys on a keyboard. Written communication is important for children who cannot speak easily or at all, and is also necessary for academic work. There are several devices available that can facilitate writing. So they can range from simple, low technology things like grips or specially designed pencils. Um, there's also adaptive devices that can enable a child to hold a writing implement, like a pen or a pencil or a marker, and manipulate them to write or draw or scribble whatever they would like. There's weighted pencils or pens. For instance, they can help a child get more leverage and more easily manage the tool while learning how to write. There's also something called a steadying device, which can be attached to a pen or a pencil to help a child with shaky movements. Having a desk with a surface that can be adjusted for height and angle can also really help a child get the proper alignment and uh, be in the most comfortable position for writing. A child who struggles to use traditional writing implements may benefit from the opportunity to type, but some children have a hard time using keyboards. And a simple adaptive device is a pointer that is attached by Velcro to the hand or the wrist, allowing a child to press small buttons on keyboards, tablets, or phones. Other typing technologies that can help children communicate more effectively include word prediction software, as well as spell and grammar check. Hearing aids. Hearing loss is an issue that many children with cerebral palsy struggle with, but technology has come a long way in providing devices to improve their ability to hear. Hearing aids, for instance, can facilitate hearing for those who are not deaf but have some level of hearing loss. For children with more severe hearing deficits, a cochlear implant may be a good option. Getting a cochlear implant is not recommended for all children with hearing difficulties. It's expensive, it requires surgery, and it comes with some rare but serious health risks. Um, Now, that being said, it is particularly recommended for those children who have multiple special needs and complications from cerebral palsy. The idea is that being able to improve hearing can be a significant benefit for a child struggling with severe disabilities. Something that's really cool that we can use in our classrooms. There are other devices that are called assistive listening devices. So these devices capture sound, amplify it, and deliver it to the ears of the students. A good device can help a child hear their teacher speaking in the classroom, even with a lot of background noise or discussions going on around them. Technology to help with daily activities. In addition to the assistive technology devices that help children with specific issues like hearing, writing, communicating, there are a number of adaptive tools that help with the activities of daily living and their school life. These are devices that can make life easier, make a child more self sufficient, and help them achieve greater independence. Some of these specially adapted devices that they can use at school, um, there's specialized toilet seats or safety bars in the bathroom. Non-skid rugs are important if you have a student who is in a wheelchair or a motorized scooter. Um, Tables that can be adjusted, they can have their height moved up or down, are very important for those with cerebral palsy. Adaptive scissors and other art supplies or writing tools are important to have for students with cerebral palsy. And another piece of equipment that can help is something called a universal cuff. This is it pictured right down here. It's very cool because students from a very young age can wear it, and it can help them play with toys, brush their teeth, paint, write, draw, eat. It's a great tool that can help children with motor impairments use their hands to perform tasks that require finer motor skills, such as gripping, that they might usually struggle with. It basically creates a handle so that the object is easier to hold. And this brings us to the works cited page. Thank you so much for listening, and I hope that you learned a little bit more about cerebral palsy and the amazing students that have it, and some ways that you could help them when they come to your classroom.